Today we are looking at colonoscopic findings of a 65-year-old lady who presented with 2 days of fresh blood in stools, which is also called hematochezia. Here we can see multiple diverticulae. She was a case of coronary artery disease on antiplatelet medications. So this bowel preparation was good, and here you can see the diverticulae. Diverticulae are small pouch-like out-pocketings of the colonic wall. Why do these diverticula develop? They are believed to occur because of age-related weakening of bowel wall along with the increased pressure inside the colon. Factors such as low fiber diet, constipation, obesity, smoking, and lack of physical activity contribute to formation of these diverticula. Diverticula is very common in Western population, and by the age of 16, nearly 50% of adults have diverticula. So here you can see again a lot of diverticula being seen as we go deep inside the colon of these patients. Most people with diverticulosis never develop any symptoms, and they are discovered incidentally during colonoscopy. However, complications can occur like diverticular bleed, like in this patient, diverticulitis or inflammation, abscess, and sometimes perforation. So in this patient, although she presented with bleeding, no active bleeding point could be seen or recent stigmata of bleeding could be identified on colonoscopy. So this is the end of the colonoscopy of this picture of this patient. Thank you.